This video is on some questions and answers on the topic uh, needle stick injury, which is a very important topic. Uh, the first question is the rule of three for transmission risk after NSI, that is needle stick injury. So, three main important viruses are there. First is HBV, that is hepatitis B virus, HCV, that is hepatitis C virus, and HIV, human immunodeficiency virus. So the risk of so the rule of three is the risk of transmission for HBV is 30%, HCV is 3%, and HIV is 0.3%. Hepatitis A and E we can exclude because those are transmitted through fecal route. Just shift the decimal to the left. That is 33 and the 0.3. This is a very frequently asked MCQ. This question, the rule of three. So the next question number 2 is immediate first aid. We know after needle stick injury there should be an immediate first aid. So what are the actions to avoid on the wound? That is, do not squeeze it, milk it, or rub the wound. Just gentle run under running water, running tap water. Just wash it gently. Do not squeeze, milk, or rub the wound. The next question, that is the immediate first aid. How should you clean? Wash with soap and running water for at least 10 minutes. If, the question number 4, the next question, if there is exposure to the mucous membranes like eyes or mouth, what should you do? Flush with copious amounts of clean water or normal saline. Do not use soap here. And the next question is HIV PEP. PEP stands for post-exposure prophylaxis. What is the maximum window for initiation? What is the maximum time within which you have to start the post-exposure prophylaxis? There is 72 hours, 3 days. But it should be preferably or ideally started within 2 hours. The next question, what is the duration of treatment according to NACO guidelines? NACO stands for National AIDS Control Organization. So the duration of treatment under NACO guidelines is 28 days. The current first line NACO regimen, that is the next question, that is TLD regimen: tenofovir, lamivudine, and dolutegravir. The doses are 300 milligram, and 50 milligram. Dolutegravir is 50 milligram. These drugs are available as an FDC, as an FDC fixed dose combination. The next question. These questions are on the hepatitis B virus post-exposure prophylaxis, and there is a way to remember it. This might feel very cumbersome to remember, but there is a way. First, let's imagine a case scenario that someone got a needle stick injury and he is vaccinated. Okay. The first case scenario, vaccinated. That is question number 8. Vaccinated healthcare worker and hepatitis B surface antigen positive source. Source means the patient. Patient is hepatitis B surface antigen positive, and the healthcare worker is vaccinated and responded. Means there is an ideal antibody titer present in the serum. So in that case there is no treatment required. Let's come to question number 11. Vaccinated healthcare worker and responder, but the source status is unknown. We don't know whether the source is HBs antigen positive or not. So there also no treatment is required. Now let's come to the unvaccinated individuals. So that is question number 9. Unvaccinated healthcare worker and the patient, the source is hepatitis B surface antigen positive. In that case, give him hepatitis B immunoglobulin 1 dose and start the vaccination because he is unvaccinated. Let's see another case of unvaccinated healthcare worker. That is question number 12. Here the source status is unknown. In question number 9, the source status was known. The source was positive. Here source is unknown. So in that case, complete or start the hepatitis B virus vaccine series. Let's come to question number 10. Healthcare worker is non-responder. Okay, he failed 2 series. Non-responder means the antibody titer is very low. And the source is hepatitis B surface antigen positive. In that case, give 2 doses of hepatitis B immunoglobulin 1 month apart. That is, if one is given in February, another should be given in March. Another case is there. That is in question number 19. Here also, the responder is the patient. The healthcare worker is a non-responder. But in this case, he has failed only one series. So, and the source is hepatitis B surface antigen positive. In that case, give 1 dose of hepatitis B immunoglobulin and start a second 3-dose vaccine series. Next question, hepatitis C virus post-exposure management. There is no post-exposure prophylaxis recommended for this virus. Perform just baseline and follow-up testing. Baseline testing required after needle stick injury for both healthcare worker and the source. We have to do HIV rapid test, here hepatitis B surface antigen test, and anti-HCV immunoglobulin test. The follow-up testing schedule, like if you have got a needle stick injury today, the test will be done today, but the follow-up testings to see the follow-up testings in future, when will it be done? The first follow-up testing will be done after 6 weeks, then after 3 months, then after 6 months, under the NACO guidelines. Common side effect of tenofovir to monitor, that is nephrotoxicity, elevated creatinine. The reporting protocol after NHSI must report to the hospital infection control officer immediately. Risk of transmission, the question number 18. Hollow bore needles, example is IV cannula. It has a higher risk of transmission rather than the solid needles, that is suture needles. I already discussed the question number 19. There might be a confusion in this question number 10 and question number 19. Here the healthcare worker is a non-responder. Non-responder means the anti-HBS antibody, anti-HBS antigen antibody titer is less than 10 milli-international unit per ml. So he's a non-responder. Non-responder is clear. That is the antibody titer is less than, the anti-HBS antibody titer is less than 10 milli-international unit per ml. Now the series failed, 2 series failed. There should be it means failed after 2 series. Means the healthcare worker has received 6 vaccine doses, 2 series, 6 vaccine doses. But after receiving 6 vaccine doses, then also his antibody titer is less than 10 milli-international unit per ml. But in question number 19, here also the healthcare worker is a non-responder. That is, his antibody titer is less than, the anti-HBS antibody titer is less than 10 milli-international unit per ml. But that is after 1 series, means after 3 doses of the vaccine at 0, 1 and 6 months. In this case, we give him 1 dose of hepatitis B immunoglobulin and we start a second 3-dose vaccine series to complete the 2 series. So I think now it is clear. In question number 10, we give him only 2 doses of hepatitis B immunoglobulin because he has already completed 2 series, right? But in question number 19, he hasn't completed 2 series, so we give him the second 3-dose vaccine series as well. I think it is clear now.